Today I'm going to walk you through how to care for your skin after Morpheus8 treatment. The biggest thing for us to remember after Morpheus8 is to treat the skin like it has a wound. What does this mean? Keep it clean, keep it dry, keep it away from the sun, out of the heat, and don't use any products on it that you wouldn't put on a wound. Why are you going to treat it like a wound? It's not going to look like you have a wound. You might be red like you have a sunburn. You might be slightly swollen. The wound is inside of the face because the radio frequency, that ablative injury, is happening at a depth of 1 millimeter to 4 millimeter inside of the skin that's being treated, depending on the area, depending on the goal of what we're trying to achieve. The wound, however, will be covered by microchannels because our micro needling gun has 24 micro needles that are puncturing the skin over and over again. So you're gonna have these microchannels that you cannot really see or appreciate but are there. And the microchannels will remain open for up to 48 hours. You wanna make sure you don't get any dirt, grime, product, makeup stuck inside of those microchannels. If you do that, you will risk having a very deep zit or a granuloma, and those can take a really long time to heal. So the best thing you can do for those 48 hours is to keep it cool, clean, calm, and collected. One thing that I really like to recommend is Skin Nectar. I have a little sample of it here. Skin Nectar is an incredible product. It's made for post-procedure skin by Elastin, which is a medical grade skincare company. The product is peptide based. That allows it to really get into the skin. It allows it to go through the skin barrier, clean out the old collagen and elastin, and build new collagen and elastin while keeping your skin moisturized. But it isn't a deep, heavy moisturizer. It's a very dry moisture. It's so smooth. People tell me I get addicted to Skin Nectar because it's like a very smooth, almost like gel-like. I actually like to use mine as a primer when I'm not doing post-procedure skin, but it just goes on really smooth. It's a gel. It'll keep the skin moisturized. It'll keep the skin happy, but because it's made for post-procedure skin, we don't have to worry about getting stuck in the microchannels and creating any kind of issues afterwards. The skin stays happy. It stays nice and moisturized, and it stays ready for collagen and elastin production. We do this for the first 48 hours. So the only thing you're going to do for 48 hours is a gentle cleanser, potentially some Skin Nectar. After 48 hours for the first week, we're gonna keep it really gentle. So no products with vitamin C, retinol, glycolic, or salicylic acid for the first week. After the first week and into about a week before you come to see me next, you can go back to your regular skincare routine using whichever products you prefer. You can use a retinol, you can use your glycolic acid, your salicylic acid, your vitamin C serums, etc. And I'm going to encourage you to exfoliate because exfoliation will help the skin turn over and help keep the skin nice and bright as it's healing. When you come back